Welcome to Improving Maternal and Child Health in Thomassique, Haiti. It's a global grant 2099950. It is the international club that's sponsoring the grant is the Punta Gorda Rotary Club in the Florida District 6960. And the host club is the Hinch Center Rotary Club in Haiti, District 7020. And we're cooperating with medical missionaries who run the St. Thomas Clinic in Haiti. I'd like to introduce now Logan Schultz, who's a Medical Missionaries Fellow and also a member of the E-Club of Florida. Logan?
Thank you. Hello, everyone. Once again, my name is Logan. I wanted to begin by saying thank you for taking the time to learn more about this global grant. I've been collaborating closely with Rotary clubs of Punta Gorda, Palmetto, and Inch on this exciting grant, and I started this while I was a Global Health Fellow in Haiti from 2019 to 2020. So I wanted to start by giving an overview of Haiti's hunger problem as the poorest country in the Western Hemisphere. Haiti has been uniquely impacted by food insecurity and hunger, and recent political unrest has led to a shocking 40% of the Haitian population going into acute food insecurity. So according to the UN Food and Agricultural Organization, Thomassique, which is the community in which we work, and you can see that on the map on the right here with the yellow star, is designated as having a crisis level of food insecurity. So Haiti's food insecurity has had a disproportionate impact on its youngest citizens, with an estimated 1 in 5 children in Haiti are actually malnourished, and 1 in 14 unfortunately die before the age of 5, which is a pretty shocking number. And these deaths are most often directly or indirectly resulting from malnourishment. And we know in pediatrics that malnutrition in early childhood can have far-reaching implications that can extend well into adulthood, impacting intelligence, educational attainment, and future income potential. And as a result, treating malnutrition early on has been found to be particularly cost-effective. So with the advent of COVID-19 pandemic, which has impacted all aspects of life, it is also predicted to have a particularly devastating effect on food insecurity. The World Food Program estimates that acute hunger would double across the world by 2021, especially in the most vulnerable countries such as Haiti, which is ranked in the top 10 food crises worldwide last year. Affecting food supply chains, COVID-19 is expected to divert resources from other areas, such as malnutrition, which is only going to further exacerbate the situation. UNICEF has proposed a theoretical framework to better understand the root causes of malnutrition. At the most basic level, a country's social and political context can leave households vulnerable to inadequate resources to achieve food insecurity, a healthy environment, and adequate feeding practices. And as a result, inadequate dietary intake and diseases can conspire together to produce malnutrition in children. So our cooperating organization is St. Joseph's Clinic, which is the clinic where I worked at from 2019 to 2020. St. Joseph Clinic is the only permanent medical facility serving Thomassique and has been running continuously since 2006. It operates with a certification by the Haitian Ministry of Health, which is called MSPP, and is staffed by an exclusively Haitian workforce, including permanent physicians, rotating social service doctors, midwives, and nurses. The clinic has also an aggregate of community health centers that are staffed by trained community health workers who are used to screen children in remote areas and provide primary care for the region more generally. Our program at St. Joseph Clinic serves clinically identified severely malnourished children in accordance with the Haitian national and international guidelines. On average, 60 children are simultaneously enrolled in the program, who are supervised by the program coordinator and clinic physicians. Families are typically screened and enrolled in the program at the clinic, where they will return for follow-up and education. Village visits also allow us to reach families in more remote areas and are carried out on a rotating basis as needed. Lastly, home visits are conducted to provide families with health education and to assess their living conditions, as well as provide follow-up for high-risk children. So the main tool we have in our arsenal for treating malnutrition is called Medica Mamba, which is a ready-to-use therapeutic food, or RUTF, which is designed to provide nutrition to acutely malnourished children. It's produced actually in Haiti by a partner organization called Med and Foods for Kids, which we've been working with since the inception of the program at the clinic. And Medic Mamba is a combination of peanuts, powdered milk, sugar, vitamins, and oil, which provide a complete complement of caloric intake and nutrients necessary for both maintenance and catch-up growth. So in summary, kids can take this and almost not eat anything else and still have the nutrition they need to grow and thrive and catch up to where they need to be. And parents can actually take Medic Mamba home with them and give it to their children themselves. So long hospital stays are not required, which eases the burden on an already overwhelmed healthcare system and allows these parents to take care of their children and family members at home, or continue to participate in income generating activities to help attenuate poverty in the household. So while we were in Thomassique, we conducted 3 focus groups and compiled the findings to create a comprehensive community needs assessment. So we interviewed 3 different groups. The first was Thomassique's community members, which includes people living near the clinic but who do not have any major ties to clinic programs. Second were the stakeholders, which included mothers of children enrolled in the program. And lastly was healthcare providers, which consists of clinic doctors, nurses, midwives, community health workers, and traditional birth attendants. So from these focus groups, 4 major themes emerge. The first being inadequate dietary intake and food insecurity. So caretakers really stated that they found it incredibly difficult to provide their children with a nutritionally diverse diet because of financial constraints. And the wider community and healthcare providers also echoed this sentiment, explaining that parents often do not have access to a balanced variety of food to meet their children's dietary needs. The second theme was that of underlying diseases. And one of the most immediate consequences of childhood malnutrition is the increased risk of exposure to disease, such as diarrhea, cough, and fever, and the lack of availability of and access to prevention items such as mosquito nets, potable water systems, and latrines only exacerbates the burden of malnutrition even further. The third theme identified was barriers to care, and the median distance for children enrolled in the program was actually 67.5 minutes, and parents do not have the money to cover transportation costs. Lastly, the final theme that emerged from the focus groups was that of education. And we had identified knowledge gaps pertaining to the causes of malnutrition, severe effects of malnutrition, and steps to receive treatment. However, there was a strong desire expressed by all these groups to learn more about health, wellness, and all caretakers expressed interest in learning business and agricultural skills as well. So given that the determinants of childhood malnutrition are so multifaceted, this Rotary grant really takes a holistic, comprehensive approach to addressing the burden of disease in the region. Our 3 goals include, first, to treat the immediate causes of severe childhood malnutrition. Second, to help prevent those underlying causes of malnourishment. And then third, to empower and educate caregivers. So first, I wanted to begin by sharing that we developed this proposal to align with the Rotary Foundation's goals, and we are continuing to work with the Rotary Foundation to ensure the project meets all of these requirements. So now I wanted to go into a little more detail about how we will accomplish our 3 goals, and begin by saying that each of our objectives has a robust monitoring and evaluation component happening tailored to each goal. And these can be seen at the bottom of these next 3 slides. So given that the clinic is facing more demand for this malnutrition program than it can currently meet, this is due to the very high rate of childhood malnutrition in Thomassique and crisis level of food insecurity that is also rising because of the COVID-19 pandemic. This global grant really first focuses on addressing the immediate causes of severe malnourishment. And this will be accomplished through reinforcing their efforts to treat severely malnourished children on a routine basis with Medic Mamba and essential medications. This grant will also improve the program's ability to deliver individualized care to each child by monitoring their progress at routine program appointments, conducting those follow-up house visits, and really teaching those caregivers how to administer the treatment themselves. And lastly, we plan to equip caregivers with items to resolve some of those underlying problems of childhood malnutrition, which I'll talk about more on these next slides. So in order to prevent those underlying causes, which is the grant's second goal, the initiative plans to empower families to be the drivers of their child's recovery and increase community awareness of malnutrition by really focusing on malnutrition prevention through a family-centered, holistic approach that integrates education. We also plan to address the underlying causes of malnutrition and disease by providing better access to prevention items. These include things like hygiene kits, mosquito nets, potable water systems, and other nutritional supplements. And very lastly, we plan to provide continued medical education and training to clinic health professionals. This includes the clinic's malnutrition director, the clinic staff, including those triage nurses and physicians, and the community healthcare workers in the 5 outlying villages. Our very last goal is to empower and educate caregivers. So this grant really focuses on using education as a tool to complement those programs' direct services that are addressing childhood malnutrition through the use of the Medic Mamba, that ready-to-use therapeutic food and essential medications. So specifically through formal education classes, we aim to encourage behavior change in order to increase the uptake of nutrient-specific practices. This is related to food, health, and care, which can then lead to improved dietary intake and health statuses for families and their children. And one of the topics they were learned in the grants classes is that prevention of malnutrition begins with prenatal care, breastfeeding, and improved hygiene and sanitation. And additionally, through our program, we hope that caregivers will gain the confidence of driving their child's recovery, gaining literacy skills and how to manage those income generating activities. And some of these monitoring and evaluation components we'll be looking at include the total number of community members trained, and then also conducting the pre and post test assessments. And also, lastly, we have 3 additional goals, which include developing an academic research project to show the effectiveness of our program. Second, to develop partnerships with other clinics and NGOs to exchange ideas and protocols. And then thirdly, to expand our malnutrition program to reach pregnant women. So returning to this, not surprisingly, our Rotary Community Needs Assessment aligned with UNICEF's framework that I introduced in the beginning and has informed the creation of our global grant to address some of those immediate, underlying, and basic causes. And we believe that by reinforcing the clinic's current primary care network, this global grant could more effectively deliver assistance to more malnourished children in need, subsequently saving more lives and improving maternal and infant health in the region. So now I will pass it on over to James again, who will talk about the progress we have made so far on this Rotary grant.
Thank you, Logan. Thank you very much. That's a good overview. And what we've done so far is to conduct the community needs assessments and to actively involve the benefiting community in the project. And of course, my Rotary Club, the Punta Gorda Rotary Club, has taken on the task as international sponsor. I'd just like to introduce you to the people here on the right of the screen. From left to right, in the wheelchair is Junior, who is the clinic administrator. Next to him is Dr. Lawrence, the chief physician, and Kira Sarazin, who is a medical missionaries fellow, and Wilner, who is the director of the Medica Mamba team, and then of course Logan Schultz. You can see Wilmer up in the picture above, working with a patient and getting them ready to take Medica Mamba. And the Palmetto Rotary Club, you can see their logo right in the middle of that bottom picture, donated, prior to this grant, donated thousands of dollars of Medica Mamba to this project. And we're very grateful for them to be in this with us. The host sponsor is the Hinch Rotary Club, Hinch Center Rotary Club, which you see on the right-hand side at the top photograph, having a meeting with Logan Schultz. You can see him down the right-hand side of the slide. And then you can see the officers and members of the club below. The grant has been started through My Rotary. It's in draft form right now, but we hope to lock it up by the middle of May. The Haiti Task Force has endorsed our grant. Haiti has a task force that deals with all NGOs doing work in the country of Haiti, and they have to approve these things, any projects that go on, and they have given us their endorsement. We've had meetings with John Walland, who's the area focus manager for maternal and child health. We've met with the TRF regional grants officer, and in our district 6960, David Lusty, our global grants coordinator, is on board with this. Our timeline, as you can see here, is we're about halfway through the initial part of this. We've got the community needs assessment. We've got the primary and the host sponsor clubs. We've met with the Rotary Foundation and are continuing to. And in the year 2020, we started seeking contributions. We've received quite a few contributions, which I'll mention in the next slide. And then in this spring, we submit the grant through My Rotary, and the project will start in the summer of 2021. Our first year budget on the left includes Medica Mamba, medications, prevention items, child referrals from villages, and education class materials. It includes instructor training, transportation, malnutrition program consultation materials, and program audit and grant management. Our fundraising goal is $100,000, and overall we've raised a little bit over $65,000. It may be up as high as 69,000. Now I have to double check, but we're getting close to that $100,000 we would like to have. And our intent is that we hope to be able to continue this as a multi-year grant so that we can get all of the goals that we have completed, we think, in 4 to 5 years. Oop. And here is, I want to thank you, and you can see who I am. Our colleague Duke Rateau in our club is from Haiti. He's on our committee. The Palmetto Rotary Club has 3 members, the Hinch Rotary Club and the St. Joseph Clinic. And there are 2 important people here, Kira Sarazin and Nicholas Cuneo. Kira, I want to thank them and let you know that they're working with us in this. Kira and Logan served as Global Health Fellows for Medical Missionaries, the St. Joseph Clinic. Kira worked closely with the clinic's childhood malnutrition program and helped initiate and develop the global grant. Dr. Cuneo finished his residency in internal medicine and pediatrics at Harvard's combined program and is an assistant professor in medicine and pediatrics at Johns Hopkins University School of Medicine. He actually started at the malnutrition program at the clinic over 10 years ago and has been helping consult with us on the grant as well. So we're very grateful for their efforts, their work in starting it out in the very beginning. So if you have want any information, further information, I'd be happy to send it to you. If you'd like to see a copy of the draft grant, that would be available. Please see my email there, my direct email and my telephone number. And got a cat on the loose in here. For more information on our work in Thomassique, Haiti, contact Logan or Kira at fellows@medicalmissionaries.org. And I believe that's your phone number there, Logan.
Correct.
So that would be wonderful. We'd love to hear from you. So if I wish this was a live show so we could have questions. If you get a chance to pick up one of our live Zoom sessions at the PETS meeting, that would be wonderful. Thank you very much.
Thank you all.